When it comes to caring for a loved one with Alzheimer's, there's no one-size-fits-all formula, and a person's needs change at different stages of the disease, which is why choosing the right care at the right time is very critical. And joining me now here live in studio is Mary Underwood, the Senior Vice President of Memory Care at Artis Senior Living of Branford, along with Maria Tomasetti, the Regional Director for the Alzheimer's Association, South Central Connecticut. Welcome both of you here to CT Style.
Thanks so much.
Wonderful to have you here. Alzheimer's is something that with the research isn't necessarily getting better. It's becoming more and more common. So what are some of the signs that people can keep an eye out for?
Some of the signs are memory loss that disrupts life. People have trouble remembering recently learned information, trouble with familiar tasks, things that they've always been able to do very easily, changes in communication, misplacing things and losing the ability to retrace steps, changes in judgment, and sometimes changes in mood and personality.
And it's becoming more and more prevalent, very common here in the state of Connecticut. So what are you guys doing at the association to try to put an end to Alzheimer's?
So there's research throughout various areas, and our national organization and national association does help to fund research also. And then a lot of what we do with the association is providing supports for people that are currently have loved ones who have Alzheimer's or related dementia.
Yeah, and it's really life-changing. I've been involved for many, many years with the Walk to End Alzheimer's up in Enfield, and Gills, and New Haven, and it's really wonderful work that you guys do every single year. And Mary, for you guys at Artis, you do some great work as well with some of these patients.
Absolutely, and we focus only on memory care because it is a unique way of providing care. Many times people focus on and families worry about, are they fed, do they have their meds, you know, all the concrete things. But with memory care, it's about socialization, engagement, it's about, you know, cognitively keeping them engaged.
Yeah.
And because their judgment and decision making, as Maria talked about, is impaired, it's a 24-hour-a-day need for care. It's not just blocks of time.
And it's progressing as well over time. The disease is changing, and it's changing your brain in a sense. So what are you able to do over time to help these patients adapt?
The most important thing we do is we accept them for where they are in the disease process. It's not trying to get them to do something they can't do. A person with some form of dementia, to force them to remember, to force them to do cognitive brain activities that they can't do isn't what's in their best interest. It's letting them enjoy the moment, having a purpose, treating them like the human beings that they are.
Sure. And what are some of these activities that are able to sort of help them along the way?
We do some of the fun things that people like to do, but what we really focus on are purposeful, meaningful events. We do volunteer work in the communities. We get involved in the local walks to end Alzheimer's for their own cause. Sure. We have residents who will do, housekeeping tasks within the community. So.
Yeah. And what can people do to help put an end to Alzheimer's? Obviously, we've mentioned the walks, but if somebody's feeling moved by this segment right now and they'd like to make a donation or help with the disease, what can they do?
Yeah. They can contact the Alzheimer's Association, and some people help by volunteering, other people help by making donations or doing special events, and even raising awareness is a huge way of just helping people understand. There's still a lot of confusion and misinterpretation regarding Alzheimer's and related dementias, so getting involved with us, we can
And for
help.
people living in the communities, I think it's important that you embrace your friends and families who have this disease. It's not contagious,
right.
And often there is a lot of isolation, so support your loved ones out there who are dealing with this disease.
Excellent message that you guys both have. Maria and Mary, thank you so much for joining us here today on CT Style, and we'd like to give a special thank you to the Alzheimer's Association of Connecticut along with Artis, and we invite you to check out their website, artisseniorliving.com, for more information. You guys are really doing great work here in Connecticut, so thank you so much for joining us.
Thanks so much.
All right.